The American Medical Association is taking another look at the group's current guidelines on physician-assisted suicide. The AMA Code of Ethics reads in part, physician-assisted suicide is fundamentally incompatible with the physician's role as healer, would be difficult or impossible to control, and would pose serious societal risks. After a 2-year study, an AMA ethics panel recommended keeping that language, but at the annual AMA meeting this week, members voted down that recommendation in favor of further study.
Assisted suicide has been an issue since ancient Greece when Hippocrates took a firm position on the matter. This issue then returned to the public sphere in the late 1900s. Nationwide polls have illustrated a shift in the public's opinion on physician-assisted suicide over the last century. Most recently, the polls showed a vast majority approval in 1996. The first Right to Die bill was proposed in 1967. Despite gaining attention, it did not pass. Almost 10 years later, 10 states have passed death with dignity laws. Then in 1987 and 97, respectively, California and Oregon passed laws that allow physician-assisted suicide. In 2006, the U.S. Supreme Court upheld Oregon's assisted suicide law, stating that doctors should not be punished for prescribing life-ending drugs to terminally ill patients. Finally, by 2018, 7 states and D.C. have legalized the practice of physician-assisted suicide.
As it stands today, in states where the practice is legal, there are general prerequisites for physician-assisted suicide. The following are an example of those prerequisites for Oregon. The individual must 1. Be 18 years of age or older, 2. A resident of Oregon, 3. Capable of making and communicating healthcare decisions for him or herself, and 4. Diagnosed with a terminal illness that would lead to death within 6 months. Additionally, in the state of Montana, physician-assisted suicide can only be prescribed if the court approved it using the same prerequisites as mentioned before.
Insurance companies provide funding options and treatments for patients with terminal illnesses. With the increased pressure and scrutiny on insurance companies to provide more improved and more diverse options for patients, the constitution of physician-assisted suicide as or as not a treatment from the point of view of doctors and insurers is even more vital.
However, even with states legalizing the practice, the American Medical Association stresses why the practice should be discontinued. They say, instead of engaging in assisted suicide, physicians must aggressively respond to the needs of the patients at the end of life. Physicians should not abandon a patient once it is determined that cure is impossible, must respect patient autonomy, must provide good communication and emotional support, must provide appropriate comfort care and adequate pain control. If the AMA urges physicians to discontinue the practice, insurance companies are in a tough situation. If they provide coverage for the practice, are they in a position to provide funding for the other treatments that the AMA approves of? On one side of the spectrum, there's Dr. Callister, an associate professor at the University of Nevada. This is what Dr. Callister had to say about 2 patients whose insurance companies were not going to provide treatment.
One's in California, one's in Oregon. The insurance medical directors I spoke with said they would not cover the life-saving procedure that we'd requested. But hey, by the way, have you considered assisted suicide? Quite frankly, I was stunned. This is something we didn't talk about, we didn't request, we didn't ask for. As much as most insurance companies try to come across as your best friend, they want to do whatever the least costly thing is. It's a lot cheaper to grab a couple drugs and kill you than it is to provide you life-sustaining therapy. Simple as that.
Dr. Callister's argument reiterates the role of a governing body's responsibility to define physician-assisted suicide as a treatment or not. On the other side, patients being denied this practice who want to die due to state laws should not be at a disadvantage and forced to pay for this path of treatment. For those who do not have this option, they either uproot their lives and move to a state with death with dignity laws or live with their current conditions. Brittany Maynard was a public advocate for physician-assisted suicide. Being diagnosed with terminal brain cancer at 29 years old, she was documenting her last months on Earth by traveling with those closest to her.
I can't even tell you the amount of relief that it provides me to know that I don't have to die the way that it's been described to me that my brain tumor would take me on its own. I hope to enjoy however many days I have left on this beautiful earth and spend as much of it outside as I can, surrounded by those I love. I hope to pass in peace. The reason to consider life and what's of value is to make sure you're not missing out. Seize the day. What's important to you? What do you care about? What matters? Pursue that. Forget the rest.
She promotes this practice because she believes in people being able to choose the day that they die, and she spoke out for how she did not want to be forced to live with the effects of brain cancer on her body. She did not want to be remembered that way. This is a clip from an interview with Maynard's husband and Barbara Queensley, the president of a Death with Dignity organization, Compassion and Choices, where she's explaining why people would choose assisted suicide as an option.
And Barbara, your organization isn't about advocating this choice. It's about advocating the possibility of this choice.
That's right. We think that people should have access to the choice.
Mm-hmm.
And from our experience in Oregon, the data clearly shows that just having the choice is of enormous comfort to people at the end of life. They get such peace of mind, such a sense of security. Whether they use the medication, whether they ingest the medication or not, is really becomes kind of irrelevant because they've already experienced the positive impact, the tremendous improvement in the quality of their life and their outlook, just feeling as though they're in control again, they're in control of their own destinies.
At the end of the day, physician-assisted suicide is a personal choice. Neither doctors nor insurance companies should be able to force this option on patients, but rather patients should be able to make an informed personal decision without outside influence or bias.